Star wide receiver for the Houston Texans, Tank Dell, suffered a very gruesome looking leg injury today in their matchup against the Kansas City Chiefs. Here's what we know so far. Right after the injury, it was reported that Dell had an air cast placed on his leg, and usually this is going to span anywhere from the hip going all the way down to about the ankle, and this is going to be used in any cases where we fear there's any sort of fracture and or severe instability. After the game, the Texans head coach told reporters that Dell is going to remain at a Kansas City hospital overnight with a significant knee injury. There has been a lot of speculation on this injury so far because there are several camera angles obviously showing the impact, as well as some other camera angles that show a deformity going through the knee that look like a fracture and or a dislocation. Anytime a player is feared to have suffered a fracture and or dislocation of the knee, this is absolutely going to be a medical emergency, and in certain cases both can be happening simultaneously. So with today's video, I definitely want to look at the injury replay. We'll talk about the relevant anatomy and then finally talk about what to expect moving forward with Tank Dell's injury. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy, and with my channel I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I'll also go over the relevant anatomy for that injury, as well as what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. So we see here on the injury replay that as Dell is going to make an amazing catch here, he's unfortunately going to catch some friendly fire, which is going to result in a direct impact to his leg. After the injury, he was in very noticeable pain while pointing to his left knee, as well as a lot of his teammates being emotional due to the severity of the injury. Here I have a model of the knee joint, and so the knee joint is going to be formed by this long bone known as the femur bone, also referred to as being the thigh bone, that's going to come down and form the top portion of the knee. The lower leg here is going to be formed by the tibia, also referred to as being the shin bone, is going to come up and form the bottom portion of the knee. And laterally here we have another long bone known as the fibula bone. The knee is comprised of four major ligaments that contribute to overall stability in the knee. The major one that we talked about a lot is the anterior cruciate ligament, or the ACL for short, located right in through here. Then as we flip the model medially or towards the inside, we have the medial collateral ligament, also known as the MCL. As we flip the model laterally or towards the outside, we have the lateral collateral ligament, also called the LCL. And finally, after this, we have our posterior cruciate ligament, also known as the PCL. Also, on the inside portion of the knee here, we have the medial and lateral meniscus. Now, anytime it is speculated that somebody has suffered something known as a knee dislocation, it's important to know that this is absolutely a medical emergency because we have several important structures that are going through the knee joint. In the back portion of the knee here, it's not visualized on this model, but we have a major artery known as the popliteal artery, and anytime you're getting any sort of disruption of this knee joint, this can sever that artery, and it is absolutely a medical emergency because if it happens to be severed, then blood supply is no longer getting to that section of the leg, and it can lead to tissue damage, and in really severe cases, amputation. It's important to note that amputation usually is in about only 10% of these cases, so it is more on the rare side, but it shows the severity of this. This is why the person is going to be rushed immediately to the hospital, because if this artery happens to be disrupted, it needs to be fixed ASAP. There are also a lot of important nerves that are in the lower leg here, and so once again, any disruption to this knee joint can lead to some sort of nerve damage if one of these nerves happens to be implicated. There's a common nerve that is going to be affected in about 25% of these knee dislocations, and it's known as the common peroneal nerve. This nerve has a lot of important functions that go through the lower leg, but the most important function of this nerve is something known as ankle and foot dorsiflexion. So as we're walking, obviously we're going to get push off through the foot, but in order to bring that foot back up to take another step, or if we are running, for example, we need to have that foot come up optimally. So if somebody has something known as drop foot, which is the inability for them to dorsiflex the foot, this can greatly cause impairment to the person. Sometimes a drop foot condition can resolve on itself. Sometimes it's also requiring some sort of surgery to repair it. And other times a person is going to require something known as an AFO, or an ankle foot orthotic, that's essentially going to aid the foot foot going up. So this can be a major disability moving forward if this nerve happens to be implicated. So once again, it is extremely important that after a suspected knee dislocation, that the person gets immediately to the hospital to assess for any sort of neurovascular damage. When we're talking about damage to the ligaments, anytime a person is going to suffer a dislocated knee, they're going to get damage to the ACL, the PCL, and or the medial or lateral collateral ligaments. It really depends on the severity of the injury. Sometimes it's all four ligaments happen to be severed. We've seen this with other players in the past, but it's important to note that once the neurovascular damage has been ruled out, then the person needs to be assessed for ligamentous damage, because this is greatly going to impact their recovery time. There are also pictures that are circulating around on social media that show the medial femoral condyle. Basically, that's the inside portion of the knee here, and it's greatly out of place, followed by a step-off deformity. And this can happen obviously in a knee dislocation. It can also happen when there has been a fracture either to the top portion of the knee, so that would be the distal femur right in through here, as well as an area of the tibia known as the tibial plateau. We don't know whether or not the bones are implicated in this case at this time, because the head coach and the team have both confirmed that it's a very serious knee injury. However, in instances where either the distal femur or the tibial plateau are fractured, this can also lead to a knee dislocation. So it's important to know those distinctions moving forward. And obviously, if one of these bones happens to be something known as a compound fracture, where the broken piece of the bone is going to be sticking through the skin, this is greatly going to complicate things, because it can greatly put the person at risk for infection as well as other vascular and nerve damage. If Dell has suffered fractures to either the tibia or the femur bones, this is obviously going to result in some sort of surgical intervention if they are not in proper alignment. This usually is going to be treated with some sort of hardware being put in to put the bones back in optimal alignment. Then once they go and assess the ligamentous structures, this is also going to require surgical intervention, because a knee dislocation results in severe instability at the knee joint. Usually all of the affected ligaments are going to be repaired surgically, and unfortunately this is followed by a very lengthy recovery time. So unfortunately right now it looks like Tank Dell has a long road ahead of him regarding the recovery process. It really just depends on if the bones are going to be implicated, as well as any sort of neurovascular structures in this injury. So if I happen to hear any specific updates regarding Tank Dell's injury, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish Tank Dell the best of luck moving forward. Unfortunately, this is a very heartbreaking one to see, obviously because of the severity of the current injury, but last season, his season ended prematurely, also due to a leg injury. So it's a shame to see these types of things, but we hope that he can make a full recovery and we see him as quick as possible. Thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.